Awesome.
Right. Good evening. Good evening, everyone. Thank you so much for joining us. I know that you're busy and you have very busy schedules. So thank you so much for making time for SNMA. We truly, truly appreciate it. So welcome, Dr. Means. Welcome, Dr. Odelugo. Welcome, Dr. Thompson. We can get started by having you all just introduce yourselves, tell us where you practice, what you practice, and sort of what stage you're in.
Awesome. I can go first. I'm Olivia. I am a plastic surgery resident. I'm in my 6th year, PGY 6th year in Grand Rapids, Michigan. Next year, I will be doing a hand and upper extremity fellowship in Boston. So yeah, that's what I'm doing. Thanks for having me.
Thank you.
Hello, everyone. I'm Shatachi Odolulu. I am now an internal medicine attending. That's weird to say. Graduated in June. I'm from Newark, New Jersey, and I was on the board of SMA in the past, academic chair in osteopathic culture.
Hi, I'm Chantel Thompson. I'm currently an intern in obstetrics and gynecology at University of Pittsburgh Medical Center, Harrisburg. I mentioned I'm in my first year, and I was formerly a national president of the Student National Medical Association.
Well, thank you. I'm Chinenye Bekwe. I'm a medical student at University of Wisconsin, and I'll be moderating today. So we just wanted to ask a couple questions and get a conversation going about what it's like to be a minority female in medicine. So the experience, the challenges that you have all navigated or really are still continuing to navigate. We wanted to have that discussion tonight. So before I get started with the other questions I have, I did want to start by asking what it's like for you. We know that there's such a small percentage of physicians today that are women of color. So what does it mean for you and to you to be part of that and really to just be the representation that many of us are able to look to now?
I think that's a loaded question and it's complex. I'm proud to be here. I'm also very tired. We can get to, like, I'm sure you guys are going to ask us questions about, what it feels like. And I see a question about microaggressions. It's a lot to carry. But we're slowly, I guess getting there. But it's a deep and a complex question. I'm sure we're going to get to it. But proud and tired is my response.
Yeah, I echo that. I'm one of two African American females in my program, but I also find pride in what I do because the population of the city that I'm in is almost 50% African American. So they are usually pretty surprised, like pleasantly surprised when they see me walk through the door, which makes me very proud of what I do. But it can be exhausting when you're trying to, we'll go into it, but when you're trying to advocate for your patients based off of your experience and your cultural understanding. And then also the microaggressions, as was mentioned, it can be exhausting, but it's a fine line that we walk, and it means a lot, and I'm sure that's echoed with everyone else on this panel. It means a lot.
I agree. I would say, honestly, I love it. I think for me, doing plastic surgery, I found a career that I love to do. And I have, while you never love being the only person in a room, I think it's so awesome to be in that room. And then I just hope to invite more people there. So I love it. I don't like being the only one, but I love what I do and I love getting better at it. And I love being a welcoming face to other people who want to do that. So
Thank you for those responses. And going off of that, like you were saying, Dr. Odelugo, I think that that's a conversation that we've been more so recently having a bit more. How it does get tiring to be some of the only people that everybody tries to come to. I know that we talk about this a lot in my chapter of SNMA. The few people who every time for us in school, every time we see a Black person as a faculty member somewhere, every one of us wants to try and get in with them and get mentorship and all of that. And so I guess my next question would be, what do you do to try and, I guess, maintain some boundaries and make sure that you're taking care of yourselves, even as people who are passionate about mentorship and bringing others along?
I think a big part of it is just I hate to be quoting everything, but like protecting your peace, especially when you start to cross over into residency and practice. You have a lot of things that's going on in your personal life. People have families, people have relationships. People are just struggling with outcomes from patients and maintaining all of the work that you have to do just being a physician in the first place. So sometimes it can become overwhelming when you're also adding in the that minority tax in trying to be a good representative. So one thing I had to learn how to do was to say no to things, which is extremely hard. It's very difficult because you want to be supportive and you want to reach back and you also want to reach forward. You also want to support your programs and institutions and different things that they're trying to do. And I'm sure that we all have different opinions on what can be done to help. But when you say yes so much, it can sometimes take away from things. So it's just important for everyone to figure out what their balance is, to figure out what their priority is and where their passions lie. And then also being able to, I find that it's helpful to find others who may be able to add more to the conversation in a way where it's not coming from you and also just bringing more people into it. But it can be difficult. I'm still learning. And you just figure out how to maintain it in balance and keep your peace amongst it all.
I like what you said about your priorities. I think you have to figure out those first and then you can create your boundaries. I think for me, what has been more important is there's some things you can't say no to. So as a resident, you can't say no to patient care. You can't say no to your call schedule. You can't say no to doing research projects. So when you are going to say yes to something and you have a choice, for me, I think about I want this yes to matter. So if I'm going to show up and I say yes, but I'm going to show up in a bad mood, or I'm going to show up late, or the work I present is not going to be my best, it's like my yes, while I said yes, my yes didn't really matter as much, and I want it to matter. And so if it can't, then it's a no. If I don't have something, time, energy, the expertise in X, then it's a no. Just because if it was a yes, that yes wouldn't matter for me. And I like when I say yes for it to matter and be effective and to be my best in that instance.
I think it has to be also a choice and a practice for you. So I liked what you said, Dr. Means, about knowing what your priority is and then going forth. And so once you once you have figured out what your priority is, now you have to start it's like a daily practice. You can't People get burnt out not because they don't have adequate rest. Sometimes I've slept for, maybe if I was like on an elective, 8 hours a day and I still was tired. You know what I mean? It has to be like a daily practicing of things that you do for them and things you do for me, things I do for this person, things I do for me. I have to keep doing things for me on a daily basis so I don't feel myself not having any boundaries, or not being able to be in a good mood, or being in that dark place and not really getting to figure out how to climb out before it gets really bad. And that's something that I had to learn over the course of 3 years. And I had a really crazy residency experience. So it's like I'm telling you firsthand, it has to be a daily thing, that you do something for them, you do something, to further your career for patient care, then you have to do something for yourself.
Thank you. So another question that I had that I wanted to hear what you thought about was just thinking about how women of color many times have been overlooked professionally. So whether it has to do with having your voice heard or just not being passed over many times professionally, I wanted to ask, what kind of strategies have you employed throughout your training, especially with residency or clinical rotations as a medical student? What kind of strategies have you employed to make sure that your voice is heard?
So it's actually difficult for me to answer because I'm in obstetrics and gynecology, so most of the people who are there are women. And honestly, what I have noticed over the last few years is when it comes to people in leadership positions, professional leadership positions, they often are women. Um, I'm starting to see that change happen, and it's something that I'm very happy about to see us coming up. But I'm sure that when people are thinking about their experiences in medical school, when they're in the group with other medical students and feeling like, um, a male counterpart is the one who's being responded to positively during rounds, or someone mansplaining something when you're presenting to an attending, that can be very difficult. I think it's just important for us to speak up and maintain your voice, and find that confidence when you sometimes have a difficult time trying to find that confidence. I'm a fake it till you make it type of person. I will just have a bold voice and I will say it. And I mean, I might not feel it on the inside. I'm screaming and anxious about everything, but it really comes with that. I remember at a previous conference that we had with SNMA, it was a regional conference. Someone was speaking about interviews, and they had done a study that found that, and when you compare men and women in interviews, women are less likely to speak about their accomplishments because they don't want to come off as brash and um, overconfident, whereas male um, the males in the study were more likely to speak about the things that they have done and the things that they have accomplished and not feel bad about it. And I feel like things like that, it comes from maybe societal pressures that we've had to try to not seem too aggressive. And unfortunately, in medicine, which as of right now is becoming more female dominated, and if you look at the percentage of women who are coming into medical school, but overall, it's a male dominated profession. It's important that we sometimes have to kind of become more aggressive with it. I don't know if that's the right answer. I feel like sometimes it has worked for me, but I always try to remind myself of that study to not feel too shy about my accomplishments. Be confident about what I'm saying. If I know what the answer is, to say it, and to also just defend and advocate for myself. And I hope that other people can do that and find value in that experience.
I feel like sometimes I'm gonna speak for myself, for those who aren't a fake it till you make it, and they're like one that's just like, oh, I might not try because I don't know. For those people, I think a lot of it is rooted in the fear of being wrong. Medicine kind of, and the way we're taught and how brash we're taught and the tough love, quote unquote, makes us afraid to, it shapes how we look at failure in the wrong way. and I don't like that. And so when we get out of the mindset of, oh, I don't want to speak on rounds because I might say something wrong, or I don't want to answer this question publicly or ask this question during grand rounds because people might think I'm stupid. Like, why don't I know that? There's my anxiety has upped like tenfold just being in medicine. And it's all those little things that your mind tells you, and all of these little alarm bells that don't matter in the grand scheme of things. You're there to learn, right? The best place to get stuff wrong is now, because you shouldn't be getting stuff wrong out there. You know what I'm saying? Once you get your license and you become a person, that's what I call graduating, whatever. Once you become a person, right? A doctor, this is your license is on the line. That's when you're not supposed to get too many things wrong. I mean, you do get things wrong, but you're not supposed to get too many of them. So the best place to fail face forward is now. So once you eliminate that fear of failure, or fear of sounding weird or different or dumb or whatever the case may be, that's when you just start saying things and you start discovering that you know more than you think you do. You're actually better suited for other things than you think you are. And you're where you're supposed to be, because if you look around, a lot of people had that same question. A lot of people had that same thought. They weren't going to say it though.
I think it's also important to realize that there will be people along the way who want to hear your voice. And so I can think of, for me, I've had those same things where I was nervous to say something because I didn't want to sound stupid. And I think that thought of not wanting to sound stupid really spurred in my mind much deeper than I would have anticipated. And I can think of two attendings at my current program. One of them asked me a lot of questions in the OR, and afterwards she pulled me aside and she was like, I don't want you to think I'm asking you because you don't know. I'm actually asking because you do know, and you hesitate more than you should. So she was like, I want you to realize that you know these answers, and I'm going to force it out of you until they come faster. And I really appreciated that. And I have another attending who works with me now for that same thing. She's like, she asks me questions constantly. She pushes me so much further. And she's like, it is all right there. And you need to start like believing and understanding that it's there. And so some of these things, there 100% will be people along the way who know that it's there and will help bring it out of you. And the other thing I want to reinforce is that make sure it's your voice. I love that study you brought up where you were like, oh, women don't want to do this because you don't want to sound aggressive. You don't want to this. You don't want to do this. If it's your accomplishment, it's your accomplishment. And so you don't have, if you're not aggressive, don't be aggressive. If you're not loud, don't be loud. If you're not, just be who you are. Because if you're going to speak, you don't have to speak like anyone else. You don't have to talk like anyone else. You don't have to be who someone wants you to be, because eventually that's going to wear on you and you're going to slip up and they're going to see the real you. So why not, when you're speaking and as you're learning and training to be this doctor, train your voice too to be who you are and find strength and confidence in your voice and what that voice is saying.
Thank you for those responses. I'm absolutely all for faking it till you make it as well, because I think most of the time nobody even knows that you're not all the way confident yet. So going back to the microaggressions that we had initially touched on, I did want to ask, what are some experiences that you have had of experiencing microaggressions, and how have you navigated those?
I think in surgery, I noticed it sometimes in the OR. If I ask for something and it's not handed to me, or I'll ask for something and then someone will be like, oh, can she have this? That really used to, I don't know, I mean, I know why, but that would hurt on the inside. Sometimes with patients, if they don't think you're the doctor, for it could be a number of reasons. You look this, you look that, you're young, you're extra. Sometimes with other physicians, it can be, which is not that I would say most people don't assume this is a microaggression, but something that I know upset me in my program, or kind of in my experiences, is if I'm thought of only to do things related to minorities, but then it's like, oh, why didn't you think of me for just research? So it's like you can only do like this very specific thing. And what I have found that has helped navigate is to find mentors who I trust. And so sometimes when you're new, when you're an intern, you don't even know where the bathroom is. You certainly don't know what to do with someone who's disrespecting you in the operating room in front of everyone. Like, these are not private situations. It's like very out in the open. Like, okay, I guess we do that here. And so my first, I would say 3 years, I didn't know how to do this, and I'm still learning, because a microaggression or a macroaggression, it will catch you off guard no matter how many times, you've prayed, lit some candles, had a moment to yourself. It will shock you what someone will face you with. But in the times where I've been proud of the way I've handled it is when I told the situation to someone else, and it's like, this is how this made me feel. Can I just have some outside thoughts on it? Someone who cares about me, someone who cares about my future, someone who has worked in this place before. What do you think? And those times it has really helped, which doesn't always mean I then did something immediately or this person did something, but it started with kind of debriefing the situation in a place where I could say, well, this is what this person said, and this is how it made me feel. Like, how do we go from there?
I feel like I've had so many instances of microaggressions throughout my current experience, that I don't know. There's just so many. The most common ones that I'll see is when I'm speaking to a patient. When, let's say, I get consulted on for a patient and I'm in there talking to them, getting history, and then nurse or some other staff comes in and either interrupts me or just starts doing their own thing, not really understanding that I'm one of the physicians, that's part of the team. Of course, like Dr. Means mentioned, having patients not recognize that you are the physician. A lot of my colleagues, they introduce themselves by their first name. I don't. I'm always Dr. Thompson, because I just don't want to have to correct myself in the future. And so I start off as that, and I just go forward with that. And it's because of the amount of microaggressions that I've had, to experience, that I've just had to change that about my practice. It doesn't mean that I don't respect my patients, on a different level, on a more, casual level. It's just that I want you to understand and respect me for what my knowledge is, and where I fall into your care. Um, and when it comes to those experiences that I have professionally, I found that I try not to respond immediately in the moment, unless it is that, I feel like is getting in the way of patient care that's happening in that moment. In that case, I will usually just say, like, "Hey, do you mind? I just want to finish asking some more questions, and then I'll be out of the way," so that I can kind of redirect what it was that I was doing, and that tends to get a good response. And if it is something where it's not necessarily directly in the way of the care, I will, and I feel like it's enough where it needs to be corrected, I will definitely say something to the person after the fact. When it's those microaggressions that I used to have as a student, or I would have with an attending, where you don't want to disrespect anyone, um, I've always I will always do the thing where you ask a question, ask for clarity in what it is that they're saying, because usually once you ask them for clarity, they end up revealing to themselves how absurd they sound. And it almost always works. So if you're ever someone who's has that, happen, then you just allow for them to stumble over their words. And it's actually really funny when it actually when they do that. But I do think that it's important that if you are in a space where you can, discuss it with that person, or provide clarity so that it doesn't happen again, in a way where you're not seeming like you're disrespectful, or you, don't think that it'll harm you in the future, then definitely bring it up at that time. But if you are concerned, if you're in a place where you're like a 30-year medical student and you don't want to, step on anyone's toes, then it's really important to reach out to those mentors, and, to reach out to people who you trust, so that they can either, provide you with more, strategies, or sometimes they can actually be the ones to advocate for you on your behalf and correct whatever that behavior was.
I'll offer something slightly different because we know about the microaggressions that we, receive verbally, sometimes non-verbally. If you were here at the mental health panel, I spoke about this as well, so please excuse me. But we never talk about getting ignored. So I would sit there and everybody would have a bro moment about, where they from, what med school they went to, what are they into, yeah, 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 yak, yak, yak. Everyone's having fun. And then it skipped me and it's a clinical question, right? And it's not, so you don't want to get to know about me? That's fine. Or like people presume when they look at you that they automatically can't relate. We're too different. What would she know about this? What would she know about that? And it's kind of very funny when later on, when it comes up, like maybe like someone's doing a team building event and it's two truths and a lie, and they discover things about me that they never knew. And they're like, I never would know. And you didn't take the time to ask. You didn't care to ask. You just looked at me, the Black girl, and thought, like, yeah, we're good. That happened a lot during residency. And it's one thing to, kind of like be like, dang, like I didn't expect somebody to say that to me. But it's another thing to feel like nobody would care to say something to me, if that makes any sense. Like that, I take that as a small microaggression in itself, because you don't even deem me worthy of like even giving me a chance to like say anything or let my personality shine. So it was all business. Um, and I think that kind of affected, I don't know, it depended on what their mood was, because, you have different attendings, they have different moods. If they were in a good mood, they're just, it'll be some banter. For me, it'll be business. If they were in a bad mood, it was mostly business. But like, every time if I got something wrong or they didn't agree with how things went, whether it was my fault or not, I got the brunt of it. And so it's kind of like, I don't know. I'm used to people saying things. Like I grew up with a Nigerian dad. You can't insult me. You just can't. I can take insults well, but it's the ignoring. It's the ignoring of it all. Like you didn't even, I'm not even going to bother. What would she know? That is something we don't talk about enough. And I think that actually hurts a lot more than if somebody were to say something stupid, because I was ready for that.
For the people joining and watching, please feel free to put in any questions that you have as well. But to follow up on that, I wanted to ask about like when to pursue a concern of a microaggression or even a macroaggression, and maybe when not to, especially for people at different levels and like stages of training. So med students during rotations or residents, just people who have superiors who play a significant role in their progress and success. When is it like a good idea to pursue something, and when is it potentially, I guess, when is it like potentially a problem for your career if you pursue a concern?
It's not supposed to be a problem at all, but we know the reality. So I can't I can't answer the latter half of that question, because it's not supposed to be a concern at all. There's supposed to be systems in place so that you can complain without anybody reciprocating or coming after you. That is not the case in real life. I think it goes back to those mentors that we were talking about. When you bring that to them and they hear the situation from an objective point of view, they can now decide whether it's something that you need to take further action, or even if you would be comfortable taking further action with. Because we all talk about like, yeah, let's take action, but we never talk about all of the fallout for, so you as an individual, would you be comfortable, or will you have palpitations every time you cross the hall of this person, every time you come, in the environment? And there's just there's certain things that I think are non-negotiable reporting, but then it's about you as the individual. So those mentors are really going to be a really good help to kind of feel the situation out, and then also feel you out and what you're comfortable with and what you want to go forward with doing. And then also, once that gets situated, you should be able to talk to your chiefs if you're in residency, or a dean if you're in med school, to see if you can switch your environments, right? But again, it all comes back to having that objective ear that was an advocate for you and that sees you, and that, kind of knows the lay of the land, because it's not how it should be.
I actually had a situation that I went through where I had more of a macroaggression that happened, and I wasn't really sure how to approach it because it was something that happened with someone who was over me and attending. And we keep talking about going to your mentors, but also I want everyone to recognize that sometimes your mentors aren't necessarily someone who looks like you. The environment that I was in, there wasn't really anyone else who looked like me, but there were people who I trusted who would look out for my well-being and would probably give me advice that would be for the best, but also honest. And in that situation, I went to one of those people, and they gave me really great advice and also helped me throughout the process. It was a situation where something had to be reported, and they gave me the space to, number one, decide whether or not I wanted to report it, and show me like, this is what it would look like if you did, this is what it would look like if you didn't, and these are some of the repercussions that you can see in both situations. And they also help bring in other they actually brought in other individuals who were kind of higher up in the chain, who I didn't realize would actually be advocates for me, people who they trusted, who they were like, I think, if you feel comfortable with this, I want to share the story with somebody else who can also give great advice. And they are also, they're another attending. And it ended up being that I had people in my corner, more people in my corner than I thought that I did, because I felt comfortable bringing this situation up. I do agree that it's good to bounce those things off with someone else because of the lay of the land that exists, different programs that you may be in, different hospitals that you may, different states, they have different cultures in the way that they do medicine. And one report is just a complaint somewhere else. Like one particular concern that you have is a massive form of disrespect in another program. So it's really important for you to understand where it is that you're at and then go from there. So it's just always good to just ask someone else who you may trust. And if you're a medical student, there's usually a resident who you can talk to who's like an advocate for the medical students, who is like the medical student liaison or someone like that. If there isn't one, then there's usually your dean, or there's someone who's in your institution, or who's the clinical coordinator for that program or that rotation, who's able to help you out. Make sure you just know about what those avenues are, how they exist, because they do exist, and then know what to expect from it. There have been situations where I probably could have reported things that happened, and I chose not to, just because I just didn't want to deal with it. I was already overwhelmed with other things, and when I thought about what that would look like, it didn't seem like a priority in my mind. Other people may have done differently. It, it's all situation by situation. It's kind of a gray area, but I think that the most important thing to do is just to gather the information that you have like a sounding board, and make a decision that is going to be best for you. and not necessarily a decision that's right in the moment. Because sometimes when you're passionate about something or when something is immediately happening, we can make decisions that aren't the best. So, yeah.
I think it's also important in any situation, not just a microaggression, to not always focus on what you should do for the situation, but remember what you should do for yourself. Sometimes the answer is therapy or being surrounded by people who do support you if you had a bad clinical day where you were ignored or spoken over or that. It's not as the action, and what I've noticed even for me has always been, what do I do so I don't have to experience that again? But what I have found that has been more effective is, what do I do so that I know who I am regardless of any of these situations? And once that has become stronger, my ability to speak out about a macroaggression has become stronger. Sometimes things happen and we don't say anything because we have feel so small in ourselves, and those situations continue to weigh us down. And so sometimes the work has to come on the inside, not for you to change who you are, but for you to be reminded of who you are, strong and smart and deserving and hardworking and intuitive and flexible, and all of those things that you knew at one point, but then all these situations kind of chip away at. So building strategies to make sure you're protecting who you are, so that when you're in these spaces, these hits don't become so devastating that they would actually remove you from these spaces, which can happen.
So you both talked about mentorship. And so I wanted to ask, what has been your experience with mentorship, and what value is there in having, how would you describe the value in having mentors that look like you?
I think mentorship is a 100% a necessity. I think when I started my journey in plastic surgery, none of my mentors looked like me, and it is what it is. Like, you might be a place where none of your mentors look like you. That doesn't mean you don't belong there. Find someone who is excited that you want to be this. One of the reasons I loved the program where I went to medical school is, once I committed to plastics, my mentor at my medical school was so excited for me to do plastics. I stayed on my Christmas break and we did cases together. He would talk to me about cases, send me pictures, we would review stuff. When I applied for residency, he would ask me about every interview. We talked about different questions. Like, such an important mentor of mine, and doesn't look like me in any aspect of weight. Like, he's tall and I'm short. Like, in every way possible, we are different. Such a great mentor to me. Now that I'm here, I would say I have some mentors who look like me who aren't plastic surgeons. And so there will be differences along the way, where some of my best mentors are in general surgery. Some of my best mentors are in pediatrics. I'm grateful to have some mentors in plastic surgery. Some are female, so they won't always 100% be everything like you. Some of them, I want to do hand surgery. There's a female Black attending, she doesn't like hand surgery. So you're not going to find like your exact match to say, like, that's you, I want to be that. Great, it can happen. But you will find people who have, again, navigated these waters. Being a physician, the stress that it comes with, learning all the knowledge it requires to take care of a body that's constantly changing when you're trying to solve a static problem. Like, these are deep, deep waters. These are somebody's loved one, whether they look, think, vote, sleep, any, like, they will be different, and you need to give your best. And so mentors who have survived these deep waters, who have had these different experiences, who have done research, who have had families, who have moved different places, who have gone to different heights in their careers. I think mentorship is important. They do not have to look like you. I don't even think restricting that for you is necessary. I think it's awesome that if you're like, oh my gosh, I met so and so and she looks like me, that's great. I don't think it can be that restrictive. And maybe that's just me.
I'm glad that you mentioned that, because a lot of us think, like you said, that the mentor has to be exactly you. It has to be a Black woman who is pursuing this, who has this type of family, who's from here. We are all very unique. even in the experience, not only in the experiences that we have, the type of jobs we want to have, but also the passions and the interests that we have. I'm interested in public health. I also mostly like obstetrics. But I also have a desire. I really love diversifying, and not just in, well, the way that people look, but also in the ideas, the experiences, the cultures. I really appreciate that. I want to find some type of way to meld all of that. There's no way. I'm sure that maybe there's someone out there, but the chances of me finding that person who's going to be that specific, and also have had the type of upbringing that I had, is going to be very slim. So I try to find mentors who can call towards all of those different pieces of myself. um Someone who, my program has actually a lot of people who have families and are married. I'm a single woman. I want to know what it is like to navigate the world as a single woman who's going into residency, or who is in a residency, who may be single when they're in attending, because that's going to be a different experience from someone who has kids or who is married. you know I want to find someone like that. I want to find someone who, for me, in my unique experience, I didn't match the first time I applied. I have mentors who may have had some sort of failure at some point in their journey, and they were the ones who helped me throughout getting to where I am right now. And in so many different experiences. I have S&MA mentors. I have public health mentors. You want to be able to find these people. It's almost like that village to help raise you. You want to kind of create that village, because the other side of that is that those people aren't all going to be available at the same time. And so you want to be able to pull those individuals in whenever you can. And then sometimes your mentor can just be a really great friend who, it could be like a peer mentor, someone who's trying to do the same thing that you are doing, just so that you can, bounce things off of, and can study with, and can talk about your research experiences with, or can talk about that crazy attending that you just had to do a robotic hysterectomy with. Like, you want to have those people in your corner. So there's huge value in mentorship, but make sure that you're not limiting yourself by only trying to find someone who is picture perfect exactly like you.
I'm gonna add in my 2 cents because everything was well said. I only have, if you think about the perspective about how many of us there are in medicine, it's physically impossible for every one of us to have a mentor. Just keep that in mind. That looks like us. Just keep that in mind. So you're gonna have to, at some point, there's gonna be somebody who doesn't look like you. Just adding that.
Definitely. Thank you for that. And we're going to start rounding up soon, but a few more questions that I have for you all. So, as you mentor other people, what do you typically keep in mind? What do you look for? Can you speak a bit about that?
It's personal to me. I look for that person who's quirky, in that medicine is a part of them, but not who they are, because that's me. And I like to speak to that, because when you have so many things that you like and that you're good at, and that I call having like normal hobbies, or things that aren't related to medicine, you think that because you're interested in something else for a minute, that what if I'm not a good physician because I'm splitting my time in what makes me happy, or what my other passion might be, and that all of a sudden I'm not good. Because you can't, when you're giving your 100% to something else is going to lack. Whether it is I'm giving my 100% here, right, in medicine, in residency, my friendships are going to take a hit. They did. My artsy side is going to take a hit. They did. Me being able to, I don't know, just touch grass, that takes a hit. And so we feel guilty about it. So when we choose to, okay, pivot real quick and let me focus on my mental health, or let me focus on something that makes me happy, we instantly feel guilty that we're not in a book. We're instantly feeling guilty that we didn't spend more time in the hospital or researching a case that we're on. We instantly always have that pang of guilt. And I look for the people who are in that little rut and in that little cycle to be like, hey, um, you can't literally cut yourself in all these different parts of you. They're a whole for a reason, and you can do this and still do that. It's going to be tough, it's going to be challenging, but it's okay. And I know people will make you feel guilty. You will make you feel guilty because sometimes we are our biggest, critics. Um, but everything's okay. And yes, you can be just excited about medicine as you are in this other thing, or as you are into being well and rediscovering yourself. Um, at this stage, because life doesn't pass us by. We just get older. And then when we look, I talk to normal people on like we talk to patients, but I talk to like actual people in other fields who aren't in medicine. And I just look at them and how much we've aged together but apart. And it's so different when you're in this like bubble of medicine and you go out and you speak to other people, and how just different the world is when you look up. And sometimes it's scary and sometimes it's terrifying, and it's just like, oh wow. And I have to constantly remember, like, we're not in this bubble. We can do all of these different things. We have to touch across the fields and agree. And for people who are like me that are just like, well, yeah, I feel guilty, I should have read a little bit more on this thing, and that's why I got this question wrong when I was pimped. Yeah, I'm the person to tell you, like, that's fine. And in the grand scheme of things, you're going to get to where you're going to go. You're going to be who you're going to be, with all of you, all the different parts of you, all the different parts of you that make you tick. And how you think is a benefit in this field, whether you see it or not.
I would say for myself, and just to just to make sure, the question is about the type of mentee that you look for. Um, I look for people who may not necessarily feel that they are the same as the pack. So people who might be non-traditional in the way that they arrived in medicine, um, in non-traditional, maybe in age, maybe in their family, being the first person in their family to went into medicine, maybe in just their grades during medical school, or who may have had some type of fallback or fall. I don't want to say failure, but setback that may have happened, just because you we are set to believe that things have to happen a specific type of way, and that has classically been the idea of medicine, that you go to high school, you go to college, you go right into medical school, and then you're 27 years old and you're an attending, like, or 27 years old and a resident, and that's not the case for everyone. And so I want to be the mentor for that person who may have figured it all out, and now they're, you know, 32 and starting their residency, or, is the first person to try to do this whole thing and have kind of no idea of what to expect. It's I find it's great because I think that the landscape of those who are coming into medical school and who are graduating medical school is changing. And with social media and, things like Reddit and Student Doctor Network, you can find that there are people who are not that way. Unfortunately, you can find that there are people who believe that you have to have like the highest board score. And if you have anything lower than average, then what are you even doing in medicine? I'm not for them. Good, big ups to you. I mean, you guys are amazing. That's not me. So, that's I am someone who didn't really have that many mentors coming up, like, to get to medical school. And the people who I did have had never been to medical school before. They weren't physicians. But because of that, I've learned so much in my experience. And I think that you will find others who have learned so much in their experience. And even just from learning from their peers in their peers' experience, they can be able to bring those things in. So um that, and then of course the general things that most people look for in a mentee, someone who is um diligent, who is hardworking, who is going to follow up, um, who has a passion, who's, this is going to sound sad, but who's going to kind of chase after me when I don't always follow respond to the text message, because I get busy and sometimes I miss it, and it's not because I don't care. I see it, but at the time I couldn't touch it because I had gloves on, and then I kind of forgot about the message. So um, all of those things are really important.
I know we're running low on time, so do you want me to answer that question, or do you want to ask more questions?
You can go ahead. I have just one more question.
Okay, my answer's quick. I actually don't look, which I know is not the right answer, but I don't look. When I think about the people who got me excited about plastic surgery, I, as a student, wanted to do plastics, saw them, and then they got excited when they saw me. And so that's how I address mentorship, because that's what I had not felt before. I had never been in medicine and someone be excited. And that first person was a plastic surgeon. And he was like, well, you're here. Let's drain some pus. And it's like, okay. And so I don't look for a particular anything. If someone's interested in plastics and they reach out, I'm like, well, here's what I have to offer. I answer whatever questions. I try to be there. I'm very honest. And then I just see where it goes. I don't expect, I, of course, want, like, if you're going to be in medicine, you have to be honest and trustworthy and diligent and follow through. But like, those are, you, to do anything well, you need to do those things. So if I'm being honest, I don't look for anything at all. I just open my email, and sometimes there's one from a student who says, I'm interested in plastics. Do you have a minute to talk? And I'm like, sure, let me see when I get off call.
Thank you. So I have one last question, and this one is a personal curiosity of mine, and I recognize that this should not even be a question anymore. But do you feel the freedom to wear your hair however you want to as you work?
I was actually on the natural hair panel at AMEC. Make sure you guys are registered for this year's AMEC, by the way. And yes, I do. I will say that most of the time my hair is like either twisted or in a bun, and it's not because I feel any type of way about it. I just need something that's going to fit under a scrub cap. So that's usually the limit. But when I'm on my outpatient clinic, I usually wear my hair in a twist out. Um, I I think I had more questions about, not really questions, but more um uh comments, I would say, about it when I was in medical school. And even the comments that I had weren't really negative. It was more people just interested in, management, or it's like, oh my gosh, your hair is so big, which can, for some people, can come off as negative. I just see it as like, wow, I can't believe you haven't seen this yet. I'm glad I can bring this up to you. And I try to use it as like a teaching moment, so that they don't say the wrong thing to one of my patients in the future. But I find that now maybe I don't hear much about it. I don't know if it's because I'm a resident or what, but I don't find any issues in wearing my hair naturally.
I really do what I want. I'm so sorry. I'm a self-expression babe, so, like, even in the way I dress is not conventional, so my hair, like, typically isn't conventional, but like, Dr. Thompson said, like, it's all about convenience and what fits under things, especially, because I was a COVID resident, so PPE was like, "How do I fit this? How do I do this?" A lot of people, sometimes we wore turbans because it was easier, or sometimes I don't feel, if you ever see me in here that's not mine, it's because I didn't feel like doing it, guys. It's not because I felt some type of way or I was just like, oh, like, what is this person gonna say? Yeah, I don't care about people saying something about what grows out of my head. That's crazy.
I honestly think it goes back to finding your voice. That's part of who you are. And so navigating that part of who you are in the professional workspace, again, what I thought as an intern isn't what I think as a chief, but it's because along the way I have actually taken the time to develop knowing who I am and what that means. And that's part of who you are. I think we put so much emphasis on certain things because we're taught that the whole goal is to make other people feel comfortable. And that's not the goal at all. That's not the finish line. That's not the gold star. That's not, what you're designed for. And so once you realize that the goal is knowing who I am and what I want to do and how I want to make an impact, you figure out a way to do that, which doesn't even mean your hair has to be natural. Some people just don't like your natural hair. If you don't like it, that's fine. But just the goal is not to make others comfortable, which doesn't mean you have to be like, good morning, everyone. This is what I'm doing today. Like you're still doing that for someone else. If I'm being honest, you just show up and like, okay, how many patients do we have to see? Like you're so comfortable in who you are that when you show up, you're just doing your job.
Can I add something? Because everything that y'all said is like right on point. If someone does say something, who cares? Like, who cares? I really could care less. If so, I have friends like because it's the same conversation as with like tattoos. I have friends who are like sleeved up in scrubs and like people will comment on their tattoos. I haven't they most people aren't bold enough to say anything negative to them about it, but I'm sure that they think it. They might say it behind their back, but then they might have people who are asking more questions about the tattoos like where'd you get that done? What's that mean? It is what it is. They're still a doctor. They still have a job as an attending. They're still making money. Like it ends you end up realizing that sometimes what people believe about you doesn't matter as much as just like what Dr. Mean said, how what you believe about yourself. And just like what Hachi said, like it's about your own expression, word how it is, make sure it's convenient, make sure it's safe. So you're not dragging vials across the floor or something like that. Um, and just, you know, don't worry. It probably doesn't matter as much as you think.
Thank you so much. Thank you so much for taking the time to talk today. Those are all the questions that I have for you.
Thank you so much for having us.
Yeah, thank you so much for having us and for everyone who listened. You got this.
Thank you.
Thank
Have a good
you.
evening.